Just before we go to lunch, you got just a few minutes of me. Last year, the guys were kind enough to give me time to talk about my experience since being diagnosed with Parkinson's disease in 2020, and some of the difficulties that has caused for me. I talked about Parkinson's UK as the organisation that really helped me get through the shock of being diagnosed with an incurable neurodegenerative disease. I'm delighted that the conference have decided to adopt Parkinson's UK as their official charity. And I'm very grateful for the donations that people made last year. And of course, I'm going to ask you to make some donations again this year. I know some people already have, because of a message that David sent out yesterday. Particularly those people, I'm looking at those people who came here paid by somebody else. If you're getting value out of this event, perhaps you pay a bit of that forward with a donation to Parkinson's UK. Just as we're in data mode, some facts for you. Current estimates. The last published results say that there were 145,000 people living with Parkinson's in the UK. Current estimate is that that's probably around 160,000 now. Says there are 2 people with Parkinson's are diagnosed in every hour in the UK. That means 7 people have been diagnosed since we started this morning. And I know what those 7 people went through. They estimate that with that number, there must be around 1 million people in the UK who are actually affected by Parkinson's because they know somebody in their family or a close neighbour or relative or friend. Give us a show of hands in the room if you somewhere in your family or worked mates. Yeah, see, this is a big thing, and a really shocking one on there with the rise that's predicted is that 1 in 37 people living today will be diagnosed with Parkinson's during their lifetime. So divide that by the number of people in the room, and some of you will join this happy team. And I'm going to talk about the positive side of it, but just remember why this matters. These are the officially listed symptoms that you face with Parkinson's disease. It's a progressive disease, so you gradually get to tick more off as you go along. I've been living with the disease, we think, since 2017. I've managed to tick off all those ones on the left. It's not just about a bit of a twitch and a shake. I always wanted to be one of those movers and shakers, and now I am. It's far more than that. There's a lot of mental health problems involved, and the bits of the brain that stop working affect various bodily functions as well as your tremor. You'll know that, you guys who've got somebody in your family. I have met, in the last couple of years, the most amazing crowd of people who are living with Parkinson's, who are over there on the other side, enjoying the joys of full-on dementia, psychosis, immobility, constant pain. And yet they do it with once you get through the initial shock, there's a process of acceptance. And then there's okay, I can't do that anymore, what can I do? And I meet people again and again who are just apart from FM, they're some of the most bright and brilliant people that I've ever met, who take this thing on with the most amazing attitude. And we want to really push that. So I got involved with Parkinson's UK, and I got on a committee, because I'm that kind. And we're working on this year's World Parkinson's Day. World Parkinson's Day is on the 11th of April 2023. And the message that we want to push out on the 11th of April is that living with Parkinson's can be challenging, but we do have this bright and brilliant community. And we are going to make a real noise on the 11th of April, and we're going to try and get on all the media and in all the press and get people talking about what it's like living with Parkinson's and the need for more investment in research and support for people with Parkinson's. And I'd like to ask if you guys can help, not just with money. We do need your money, but not just with money. Last year, somebody came up with a brilliant idea of lighting buildings up blue on World Parkinson's Day, because blue is kind of, for no reason at all, I've tried asking their marketing people, but other than all other charities had nabbed all the other good colours, there doesn't seem to be any particular reason why Parkinson's is blue. But last year we got 170 buildings lit up blue, thanks to local activists talking to their local councils, talking to the local churches. We had some great help from Mace Construction, who helped us get the power station. What power station? Battersea Power Station lit up blue. We got the Blackpool Tower lit up blue. And I thought, who's got a few more buildings that we might be able to turn blue? And then I thought of the FM community. Honestly, you know, between you're responsible for thousands of buildings. Maybe some of you might be able to help us by getting a blue light or some blue balloons in reception or some blue t-shirts on your receptionists, but get that blue colour out there on April the 11th. We'll do the rest in terms of, why is everything gone blue today? We'll be on the media. So you could help us by lighting up your buildings. If you're doing that, you can help us on social media as well by putting pictures of your buildings. Our press teams will promote and retweet and whatever you do on TikTok and Instagram. And help to maximise our press and TV coverage on the day. It also, by the way, gives you an opportunity to engage your employees. And remember, 1 in 37 of them are going to have to deal with this condition at some time. So a day for you to talk to them about Parkinson's would be really good. If you want to find out more, please contact us. There are contact details on here. We'll be sending them out after the event. If you want to donate, of course, go straight to the Parkinson's website. I could set up a Just Giving page, but I don't want to give them X%. So just donate straight to Parkinson's at their website. If you are really interested, if you leave me a business card, I'll make sure someone from the corporate team gets back in touch with you, or just contact me. And thank you very much for listening. Parkinson's doesn't have... I may have Parkinson's, but Parkinson's doesn't have me. And that's what we say to ourselves as a community. Thank you for your help in a minute.